Hi, my name is Alao Oluwatosin. I'm here to demonstrate how to introduce myself to the patient. Before I go into the ward to see my patient, the first thing I'm going to do is to learn and get information about my patient. Information like the level of his or her consciousness, if the patient is confused or if he is having any problem with hearing or vision or is aggressive. And I can get all this information, looking through the nursing care, a nursing care summary, also known as the cardex, or I can ask the staff nurse I'm working with. And this is to prepare me ahead of, meeting with my patient. So entering the room, entering the ward, the first thing I will first do is to scan through the room for safety concern, to look if my patient is in distress and pain, sliding off the bed, or is unstable, and or is having any difficulty in breathing. If any of this is seen, I'll make sure that I address such, call for help and address it immediately. Then I'll proceed to wash my hand. That is very, very important. And this is before I touch anything, before I touch my patient, I'll, make sure I wash my hand. And this is to prevent the spread of germs or infection from room to room or from patient to patient. And if there is nowhere to wash inside the patient's room, I will make sure that I've done that before I enter the patient's room. So after that one, I will try to let the patient, to get the attention of the patient, I can move closer to the patient. Hi, Mr. Bernard, how are you doing? Just to let him be aware of my presence in the room. And if the patient is having any defects in hearing or seeing, I will try, to tap him. And I will ensure that I'm not startling the patient so that the patient will not be scared. So after that, I'm going to introduce myself. Oh, my name is Tosin Alaho. I'm a second year student nurse, from the University of Manitoba. And I'm here today. I'll be, assisting Nurse Janet in your care. Will be in charge of your care today. And I'm going to be with you for the next 12 hours. So don't hesitate, to call me if you need help. After doing this, I'm going to, look around to see if there is anything I could do for the patient. Then before I do that, I will make sure to confirm the name of my patient. I can ask him, oh, please, can you confirm your first name and your last name? After the patient might have told me, I'm going to check it with a wristband and cross-check with the file I have with me to make sure that I'm talking to the right patient. And after doing that, I will assess the patient if there's any distress, and I'm going to, ask him question also. How are you feeling today? Is there anything I can help you with now? If there's anything, just tell me. I will assist you. And in the process, I will tell him. I will let him know our plan for today. Okay, today we are going to, like I told you earlier, I am staff nurse Janet. We are going to be in charge of your care. So I'm going to go out very soon, just to prepare the things we are going to use for you, and I will come back to come and assist you to get up from your bed, to prepare you to have your breakfast. If you need anything, like I told you, don't hesitate to ring the bell. And if there's anything you want me to do, I can always assist you there. I will try and look around. If there are clothing on the floor, if there are, things that are disorganized in the room, I will help him, to put everything in order. And then thereafter, I will make him comfortable. And I will ask him, oh, would you mind me calling you by your last name or your first name? Anything in response to, okay, that's okay by me too. So after that, I will try to conclude our chat by saying, oh, it's nice talking with you today. Thank you, for your time. And thereafter, before I leave the room, I will ensure that, I go through the proper hand hygiene, wash my hand before I leave the room. Thank you.